This month, once again, Kerala sounded the alarm with two Nipah-related deaths. Both state and central health agencies were on heightened alert, fearing the resurgence of a deadly outbreak. To much relief, no death has been reported after that. Moreover, now it looks like the end of the outbreak. A senior virologist working in a top government lab told News 18 that going by the past experience, it is over now. However, the official statements are on hold due to the ongoing incubation period of samples and people isolated. As per the World Health Organization, the incubation period is in range from 4 to 14 days. On September 13, Kerala's Health Minister Veena announced that the Nipah cases detected in the state were of Bangladesh strain. This strain is known to cause respiratory distress syndrome, which makes patients feel breathless during the initial symptoms and pushes them onto ventilators. This was the fourth time the Nipah outbreak took place in Kerala. Even if we assume that Nipah has disappeared once again, with no vaccines or antiviral drugs available to save the lives of infected patients, it is clear that India needs to put a system in place to prevent reported or non-reported outbreaks. This could be somewhat similar to the efforts made by Bangladesh, where bats were found infecting the palm sap. Nipah virus infections were first discovered in 1999 following an outbreak of disease in pigs and people in Malaysia and Singapore. However, presently, the sporadic episodes are being reported only from India and Bangladesh. In Bangladesh, the Nipah virus was discovered in April of 2001. Bat saliva and excreta were found to be the reason behind the infection, which was brought on by consuming raw date palm sap. The palm trees, which are known habitats of bats, have been protected during the season of date palm sap. The trees are now protected by wearing bamboo skirts during the collection season. Similarly, in Kerala's context, in 2018 outbreak, investigation found a link between fruit bats and mango orchards. Next outbreak in Kerala also took place in the month of May, mango season. The Bangladeshi government promoted public awareness in the vulnerable areas with habitats of bats. These programs were run especially from November to May in newspapers, regional TV and radios. Experts have highlighted the need for developing prevention strategies against Nipah by developing any fume or specific chemical so that the bats would remain out of the range of the vulnerable fruits during the harvesting seasons. Also, more scrutiny is required to understand the findings of the government survey partly released in July, which showed the presence of Nipah viral antibodies in bats from multiple states and not just in Kerala. This shows that India needs to put stronger surveillance mechanisms across the country along with working on vaccines and other treatment options against Nipah.